Hi, everyone. Welcome to the Healthcare Transition presentation from the Federation for Children with Special Needs. My name is Melanie McLaughlin, and I am the Project Director for Mass Family Voices. And I'm co-hosting today with Pat Nemia, who is the former Project Director of Mass Family Voices and is transitioning me into this role. So again, welcome, and let's get going. So who we are. So Mass Family Voices is part of a F2F Health Information Center. We have a federal grant and a National Family to Family Health Information Center from the U.S. Department of Health and Human Services. And our priority is to assist families in navigating healthcare systems and healthcare and helping them with healthcare needs. And we also do technical assistance and provide webinars and things like this. And these are some of the services, direct services that we offer. And I'll let you just take a moment to look at those yourself. Next slide. Workshop goals. So when you're done with this workshop, we expect that you have a definition of healthcare transition and understand what healthcare transition is and when and how it should occur. We want you to understand the barriers to transition, and we want to make sure that we're helping you have tools to remove those barriers and facilitate your child's healthcare transition. We want you to incorporate skills for healthcare and the healthcare transition into your IEP and understand how benefits change when your child turns 18.
All right. Hello, everybody. As Melanie said, my name is Pat Nemia, and I am co-hosting with Melanie. I am leaving my position at Mass Family Voices, and I'm so excited that Melanie is stepping in to be the project director for Mass Family Voices. So when we talk about transition, one of the things that comes to mind is change. So we think of transition as a change, and often we consider that a moment or a point in time. And so often when people talk about transition in school, they think about leaving high school, going to college, that moment in time. When we talk about transition in healthcare, we often think of leaving pediatrics and going to adult care. And so that is true, and that is what we are going to talk about. But what I'd like you to think about as we discuss healthcare transition today is that it is not just a point in time. That is really a process that occurs across the lifespan and leads up to these changes. So there's a process that goes on that leads to a successful change or a successful transition. So I'd like you to keep that in mind as we go through the presentation today. And so if we talk, so you're watching this probably prior to the conference that you'll be involved with this weekend. And when you were going to be talking about transition, typically transition conversations revolve around the education process. So they evolve from high school. There's a process or steps that begin at 14 or sometimes a little bit younger, and help think about what's going to go on after high school. So what's the process so that this youth may go to college or may go to work or may be involved in community programs. But what's often not talked about, it's often talked about kind of through that education lens, and some of the other aspects of a young adult's life are sometimes not considered. So what we want you to really think about before beginning this conference is that health of a young adult and their healthcare independence or their ability to manage their own healthcare will support a successful transition, right? Because you can put in place, I give an example of a child going to college. If a child goes to college and they don't know how to get their medications at the drugstore or what insurance card to bring, and they get there and they don't have a lot of money, and they don't wind up with their meds, that becomes an issue, right? So all of this work that started in high school to make this successful transition to college can fall apart. And, we have spoken to parents where they have seen that happen. And so think about, that health and healthcare independence is always there, supporting all of these other activities that you're doing. So it is true that as a young adult transitions to their next step or their steps after high school, that they have to navigate different systems, right? They have to navigate things that might be happening in the education system, and they also need to navigate things that are happening in the health system. They may have to navigate a housing system. So there are multiple systems that they are going to have to start to navigate. For our purposes in this conference, we're really going to be talking about the education system and the health system. And so there are specific things within each of those that you will learn about: education over the course of the weekend, health today. So that's important. But the other thing that we want to also think about in this presentation is, where is the overlap, right? Where do things regarding health independence impact the conversation of transition that's going on in the education system? So we'll look at the specifics of the health system today, but we also are going to consider, where is the impact of health on transition in education? So we're going to start by looking at just that healthcare system. So what is healthcare transition? What is the definition? And there will be, you will read different definitions depending on the resources that you engage with, but they're essentially the same. And that really, healthcare transition is the movement of young adults from their pediatric care into a more adult-oriented system of care. And it's not, and so some people may look at it, as if you think back to that first slide of change, as a point in time. Well, okay, we'll just get a referral and we'll move to an adult practice. So our pediatrician will give us a referral, we'll make a phone call, and we'll move to another practice. And that might be a component of what happens, but it is a much more complex and dynamic process than that. And it involves developing skills, I think, on the part of parents, on the part of the providers, as well as on the part of the young adults. And so I say that because kids will need to understand, going from pediatrics to adult health care, what is it that your needs are going to be? Where is going to be the best fit for you as a young adult? Where or what type of practice that you go into, will you be able to have your voice heard about your needs and about what's going on with your health, so that your transition into adulthood is successful? So we talk about, that things do change when you turn 18. And if in moving to an adult practice, one of the things that is just inherent in the health system is that pediatric practices are much more family centered and much more coordinated. Right? There's pediatricians are involved with parents. They're involved with the youth. Sorry, I have a bug in the screen. They're involved with the youth. They are also involved sometimes with the school or with programs that a child might be in. And so a good pediatric practice is definitely a family-centered practice and a child-centered practice. But when we move into adult health, it's not that practices aren't patient-centered, but because there are what are considered all adults in this group, or all people over the age of 18, more of the responsibility shifts to the patient, as far as managing their health, and as far as coordinating perhaps all of the systems of healthcare that they need. And so that's a big change at 18, and one that people don't always anticipate. So why is that important to know? Well, when your child turns 18, their health needs become their responsibility, right? So they need to call to set up their own appointments. They need to fill out the forms when they're at the doctor's office. They need to keep track of medications so they can talk to their doctor about that. So, oh, I'm sorry. I'm sorry, my battery. I'll be right back.
So as you know, Pat was just saying how things can change so much when they're 18. I know for myself, I just
Yeah.
had two, typical children go off to college, and the college won't even talk to me about any of their stuff. I can't call them. They, we don't have permission to have any input on anything that's going on with them. And I found that out very quickly with my first daughter, who ended up having like a respiratory virus shortly after she started school in her freshman year. So it is really important to be able to, teach them, and not while they're under pressure and sick and, trying to figure it all out.
So I apologize, my plug got pulled out. And Melanie's absolutely right. And so young adults have to be, this is where the process comes into play, right? So to be able to manage just these few examples and many, many more, it requires an organized transition process in which they develop skills and Melanie will talk about this a little bit more, but they develop organizational skills. They develop skills in which they can advocate for themselves with healthcare providers. They develop basic skills in, management of how they're feeling, their emotions. So we'll talk more about this, but they need to gain independence, or as much independence as they can within their situation around their health care. And that will prepare them for an adult model of care and a transition to new clinicians. And so I say, as a little bit of a shout out to parents, is that in thinking about this, and it's not something that I was really great at, but when our kids have IEPs and all these things, we tend to get ourselves to be really organized. So we have, all the dates in line and the paperwork, and we know where everything is. But do we really talk with our kids about it? Or we tell them, I'm not going to bother with them, I'm not going to burden them with this. But it is important that they have a better understanding of all these things, because I realized my son had no idea how to get medication at a pharmacy when he went to college. And then we had an issue because he was at college out of state. And I don't know why, and it just, so there were all these little things. Was it a huge crisis? No, because he talked to us about it. But we find when we hear from parents, sometimes kids, they're just like, oh, well, I don't know how to do this. And they may not bring it up. So it's really important for kids to understand and develop these skills, and that we share this with them, as they're growing. So let's go to the next slide. So one of the things that people often ask me about is, well, when do we change to adult care? Why do I have to change? My pediatrician said that I can stay with them. And so I think what I say to parents is that this is a very individualized question. And so I went searching around a while back, and actually the American of Pediatrics actually has a policy or a recommendation on this. And they feel that it needs to be based on the young adult's individual needs. And it's a decision that is not, should not just be made by the young adult, like, oh, I want a new doctor, or by the parent or caregiver, oh, we should move to a new doctor, but it should be a consultation of the parties involved. So, the youth, the parents, the pediatrician, or whichever group is the primary group for that young adult, should consider what the needs are at the time, and there should be a plan, right? So we shouldn't be waiting to have this discussion with doctors when our child turns 18. We should think about this discussion earlier on, and thinking about, okay, what are the needs now? How can we help get to a place where maybe we should transfer? But there's other things that come into play. For example, your child may have a diagnosis where, for example, we'll use the diagnosis of cystic fibrosis. Your child, if they have a diagnosis of cystic fibrosis, they may be in a medical center specialty clinic that just stays with them through lifetime. And there are those clinics for some medical diagnoses. Or you may be part of something where, you know, your youth has a very special bond with their pediatrician, and the pediatrician has a setup that, you know, where your child isn't sitting in a room with 3-year-olds in a waiting room all the time, but might have a setup where it makes it okay for them to remain with the pediatrician for a period of time. And as long as that is a discussion, then, you know, around what fulfills the young adult's needs, then that's fine. What the AAP does not encourage, or actually discourages, is an arbitrary age limit, either by healthcare providers or insurers. And so there have been situations where families have been told by their insurance policy that once the child turns 18, they don't pay for a pediatric visit anymore. So those are important things for you to know, right? Does your healthcare provider have a policy about this? Does your pediatrician have a policy about this? Does your insurance company have a policy about this? So that if, even though the AAP may discourage this, if it did happen, you know, or if it is going to happen, that you have planned for it, that you've allowed sufficient time to make sure that when that time comes, you're making the best transition, or your child is making, you know, in coordination, you're making the best transition that you can. And then I'd just like to make one other comment about change to adult care, because some people said to me, I'm just going to stay with the pediatrician. They want to stay with the pediatrician. We're just going to stay for the rest of their life. I mean, we're just not going to move. Why? You know, he doesn't care. And some pediatric practices or physicians who see pediatricians are actually family medicine, and they see people across the lifespan. That's fine. If not, though, and you're actually seeing a pediatrician, you need to consider that pediatricians are trained to treat children, and children are not adults. And that as your child moves through adulthood, even through their 20s, there are screenings that need to take place that a pediatric office may not be equipped to do. So it is important to consider that your child's medical needs change as they age, and that you need to have the best fit for them to get the best care. So that being said, is it easy to just move to adult healthcare? Well, one would think it should be. But there are some barriers for children and youth with special health needs to move to have a successful healthcare transition. And one of them is that sometimes providers may not have an expectation of this young adult that they are capable of healthcare independence. Now, an individual with a developmental disability or with a cognitive impairment may not be able to do everything without help from a caregiver or a parent. But I think what we want is to look at and plan for what they can do. And I think that, you know, so that the same as you may have full guardianship, or you may moved into a program like shared decision making, you can look at what parts of healthcare can this young adult assume, and those should be those should be brought forward, and they should be able to do those, and healthcare should respect that. There's difficulty identifying adult primary care and subspecialty providers. And I think this is true in the United States right now. We do have a shortage of primary care physicians in the adult sector. And so it can be difficult sometimes to find a practice, especially if you all of a sudden need a practice. And we hear this in general from adults who maybe move, right, from one state to another, or their PCP, their primary care physician, all of a sudden retires. And they're like, I can't find anybody. Everybody's practice is closed. Well, that could be the same situation when your child's moving out of pediatric care. So again, just another reason to have a plan in place and to be discussing this and figuring out how this is going to happen with your pediatric primary care prior to, you know, some deadline that you'll be left without care. So it's something to be considering. Other things that tend to be a barrier is sometimes the adolescent, the young adult, or the family don't really want to move. And it's very hard. I think when you have a child with special health needs, one of the constant people in your life has been the pediatrician for many, many people. You know, you may have a new teacher every year and you go to different programs and there's different leaders in those programs. But for a lot of people, the one constant has been the pediatrician. And so it is very hard. But as I said in the previous slide, it's really important to think about, you know, your child is going to be an adult, and so you have to plan for them to get adult care. So again, give yourself time. And I think one of the other things that does happen is that in we all know this in medicine, is that doctors are, you know, they're very busy in their practices, and so sometimes it feels like they may not have time to have these important transition discussions with you. And we're going to talk about some resources in a minute, but I think one of the really important things to think about is how can, for you to be prepared when you come to that visit and to say, you know, I'd like to talk to you about this transition. Here are my questions, you know, or to utilize now that people are using portals more and more, and it's easy to email a practice, to think about before you go to your visit, emailing your practitioner and saying, when we're there, this is what I want to talk about with you. So just so you know, or if there is someone in the practice, sometimes nurse practitioners handle some of these conversations, or practices may have a social worker. Find out whether those people are there, because that might be a good place for you to start a conversation, and then, you know, take that information to the primary care and talk about it with them further. So what is the timeline for transition? And by timeline, I mean, how do you work? What is the process of working with your child? When should you be working with your child to get them ready for healthcare as an adult? And actually, honestly, you know, you can start talking to your children as early as 4 years old about their situation, about some of the challenges they may face in different things, about identifying their needs. And you can also start to talk to your child about the healthcare that they're involved with. You know, use doctors' names. We have an appointment with Dr. So-and-so when they're younger. Get them familiar with terminology so that it's not something that is a big surprise to them later on and seems like something so different from everybody else. It's something that's part of their life, that's integrated into their life. And so these conversations are really important. And then the actual transition planning should begin with your physician, according to the American Academy of Pediatrics, no later than 14 years old, which, interesting, in Massachusetts works out well, because as you'll learn over the course of this weekend conference, 14 years old is when you begin the actual transition planning on the IEP. So this is a really nice opportunity for these, what can be parallel systems, to intersect. So if you're having these discussions at 14 or beginning at 14 with your pediatrician, you can bring information into the IEP meeting that would be helpful in skill development. You don't need to tell the school. This is not about bringing your medical records to the school and saying, here, look at these. This is everything that's going on with my child. It's talking about more general skill building. You know, my physician thinks we should be moving to adult care by the age of whatever. And these are some of the problems we're facing with that. And that should become part of then the skills, or talking about skills that your child's developing for transition. Developing the skills around the healthcare are equally important. Because as we said, if, you know, if a young adult who might be going to work, might be going to college, or decides at 18, you know what, I'm just exhausted from everything that everybody has managed in my life for all these years, and I am 18 and I don't have to do it anymore. And so we see that happen more frequently than not. where kids at 18 step away from their health care. And then, as I said, they start to have some health issues or things that interfere with this big transition plan that we've had, and that all falls apart. So to be able to successfully be independent in managing your health care is a really important thing to consider when you're considering the skills that you need to be able to go to work, go to college, participate in community programs or other programs. So again, a lot of food for thought. So there are some good resources out there for parents. The Massachusetts Department of Public Health has put together a health transition toolkit. This is the website for it. I'm not going to go to this website today. I'll let you investigate it, but they have lots of good information for parents. And so either after you watch this presentation or, over the course of the next week or so, really take a minute and look at some of these, because it will give you tools that'll be helpful to you when you're talking with the school. And another really, really good resource, I've used this resource over the years, and I like it more and more the more I use it, and they keep updating it as a result of conversations with families and parents. So gottransition.org is funded through HRSA and through Maternal Child Health. HRSA is the Health Resources Services Administration, and so it's kind of the federal health organization, and they fund it as a center of excellence. And GotTransition has put together tools and resources. They have a frequently asked questions guide, which I always love frequently asked questions. And they have sections for youth, parents, caregivers, providers. So you can go to your specific section. There's videos, there's resources. But one of the things that I love on this website is they have readiness assessment tools. And so your child can take one of these assessment quizzes on their own, or you can help them take it. And it gives you, when you do these quizzes, it gives you a summary, which is great because it shows where skills might be needed. And so it's a great tool if you do some of these ready assessment quizzes and you take them to the physician and you can show him, look, this is where, Johnny is having some issues with trying to manage his own health care. How can we help him with this? But in addition, it provides a really good piece of information for schools to say, okay, we know that in taking these, that he needs, and when we're looking at organizational skills, he might need some help in understanding how to keep track of his meds. So that could become, an objective within that, an organizational goal. So it's a really good tool for that. And what I'm going to do right now, as I finish, is just take you to this great little YouTube video that GotTransition has. And it's really a summary. It's 2.5 minutes, and it's really a summary of what we have talked about so far today, or about transition in the health system. So I think it will pull everything together for you. Just bear with me as I go to it. I think there's an ad first that we're going to have to listen to a little bit before we get to the video.
Is there audio with this, Pat?
Can you hear it, Melanie?
No, we cannot.
Okay. Is it showing, but you can't hear it?
Captions are showing.
Okay.
If not, I'm happy to narrate it.
Okay, hold on one sec. Let's see if this will help.
For many young adults, transitioning to adulthood can mean going to college, finding a job, or moving out on your own. This can be exciting, but also really challenging. One transition that you may not have thought about is healthcare transition, or HCT, which means moving to an adult model of care where you are the main person in charge of your health. HCT is not a single event. It's a process that can take several years. Learning about your own medical history is the first important step. So ask your doctor how to access your health information. A major part of HCT is learning to manage your own health and healthcare. To start, you can make your own doctor's appointments, fill your own prescriptions, and talk with your doctor alone. After you turn 18, your doctor can only legally talk to you about your health. Your health information and medical records will be kept confidential. It is up to you to make your own health choices. You can decide, for example, if you want your parents to see your records or be in the doctor's appointment with you. For those who see a pediatrician, HCT also means moving from your pediatrician to an adult doctor. This usually happens between the ages of 18 and 22. Some people see a family physician or a doctor who sees patients throughout their life. If you see a family physician, you'll need to change who makes your health decisions, but not your doctor. In an adult model of care, you, and not your parents or caregivers, are in charge of making decisions about your own health. To plan for this transition, talk to your doctor and ask them about their policies. If you see a pediatrician, ask them when you need to leave their practice. You can also ask them to help you find a new adult doctor to move to. HCT is all about independence and empowerment, so be proactive. Find an adult doctor who is accepting young adults into their practice and takes your insurance. And don't forget to encourage your friends to be proactive about their healthcare transition too. For tips and resources to make your healthcare transition as smooth as possible, go to gottransition.org.
Okay, are we back to the slides?
Yes.
Great. So now I'm going to turn it over to Melanie for the rest of the presentation.
Yeah, thank you. We're going to talk a little bit about the intersectionality between the health system and the education system and the impact of that on health care transition, HCT, as you just heard in the last video. So next slide, please, Pat. So again, just as a recap, healthcare transition is the process of moving from pediatric care to adult care. And the goal is to optimize and empower young adults to manage their own adult healthcare. And the process should be collaborative with, doctors and care providers and young adults and family members, if they so choose, professionals and educators as they're making the transition. So I think a lot of you are familiar with IEPs and what forms are in the IEP and setting goals and benchmarks and all those things that have happened over the years. And when your child turns 14, they'll start having a transition planning form as part of their IEP. And the transition planning form is really helping to create a plan for thinking about how your young adult who should participate in the transition planning process will be moving from, throughout the education system and into the adult world. So there is a vision statement, a post-secondary vision statement. So what does the student want to do after they leave high school? And the statement includes things like, do they want to go to, further their education? Are they looking for employment? Do they want to live independently? What kinds of things are they doing for community engagement? What would they like for recreation? And sort of thinking about how to live a full life as an adult. Transition planning forms should cover all of those things as the young adult and their caregivers and providers and folks who have been part of their lives over the years help them to think about what is it? I mean, it's hard for all young adults, I think, to think about, well, what is it that I want for my life? Especially at, sort of a young age, 14, 15, 16, but starting to think about it sooner makes it easier to make those goals and dreams come true. So that's where the transition planning form comes in. Next slide, please. And, but transition form is, a lot of times people center the transition form around education. But one of the things that we really want to make sure that you understand here, as Pat was saying earlier, healthcare is a priority, right? If your healthcare, if health becomes an issue, everything else sort of is put aside until that is dealt with. And so really being able to think about how to use the IEP as a tool and the transition planning form as a tool to help with that transition from pediatric care to young adult healthcare. And so, for example, here are some transition skills that might be in the IEP already. Things like organization skills, self-management skills, self-advocacy. Those might be part of the planning form. They might have already been part of the IEP before there was a transition planning form. And so thinking about where does health fit into those different skills and how can the healthcare transition be part of those different skills. So you can see some examples here, organizational skills. Those are, locating a doctor, planning your appointments, scheduling your appointments, things like self-advocacy, right? How do I tell the doctor what my disability is, what my needs are, what my accommodations might be? If I don't agree with the doctor, what do I do? How do I address that? What is a second opinion if I need one? And do I have the right to ask? And how do I access my medical records? And all of those things. And so, just even teaching some of the words, right? Like advocacy and self-management and organizational, right? And thinking about even just bringing it down to the basics, we're teaching the idea of advocacy now, and we teach it through a number of different ways. What does it look like? What is it? But really thinking about what that looks like in the healthcare transition system. And based on your own experience as you're helping your young adult or transition themselves, thinking about the ways in which you learned about these skills and, what would have been helpful and effective for you in making that transition. And so here's some more ideas, about transition skills in the IEP. And so really thinking about those goals and benchmarks, if we have a goal and we know that, we want our young adult wants to, live independently at some point, how are they going to be able to get to doctor's appointments if they're not actually driving themselves, or, what are they thinking about in terms of, how are they feeling, right? If they're feeling happy or sad or excessively sad, or any number of other things, how do they identify that and let, folks know what their needs are? Who do they talk to about that? In the past, their pediatrician has been their primary caregiver. So helping them understand the difference between, primary caregivers and specialists and, who you go to when you have your first point of contact, your primary caregiver, and then asking them whether there's specialized, support that they need around anything, vision, hearing, all sorts of things. Next page. Next slide. So getting back to the goals and benchmarks. So here are some examples of some goals that you might think about. So I'm sure you're all familiar with goals and benchmarks in the IEP and objectives and having measurable objectives and thinking about how they get to this place. So for example, we're looking at, Maddie using a health organizer to track medications and keep appointments with her physician. If they're a visual learner, really helping them understand some of their diagnosis, even, with some visuals and visual supports, or how can they communicate through visual supports if they need to, having a health organizer to track their information, much like a planner that they might have had at school. And if you have something yourself, being able to share that with them and show them what that might look like, or going online and helping them understand what that looks like. But having this be part of their IEP goals and creating them, they can be learning this while they're in school and making that transition to adult life and having healthcare be part of that. And I think for folks who have chronic medical conditions, they've been doing this for, a lot longer, I'm sure. So maybe working with your school nurse, if you have to help your child learn how to give insulin, or things that, any number of things. Your child, gets an injury in a sport and, has to figure out how they're going to manage getting around the school with their books, and they have crutches. And so, those are all things that are happening, when they're under, your care potentially as young adults, but thinking about that transition and what are they going to do when they're at work, if they have, those kinds of injuries, how do they manage those? What kind of advocacy skills do they need? So really thinking about how to incorporate this into the IEP is critical, because health is part of every single one of our lives and all of the needs that we have managing our healthcare. Next slide, please. And so here's an example we just wanted to give of like keeping all the records organized. Again, I'm sure for many of you folks that are here, you may have had, multiple IEPs over the years, or 504 plans, or any number of those things, even just, raising children and keeping our own records organized. But thinking about what is an organizational system for the young adult to be considering for their healthcare data? What are you using for organizing as well? What ways can they, again, visual representation, I think, is really important. So as we were looking at this ourselves, I was thinking about creating a book of providers, even with pictures and what this provider does, and why we go to this particular provider. Again, if you have children with intellectual and developmental disabilities, thinking about working with your teacher in the transition program or your special education teachers in the schools, helping them think about how can they organize this information so it's part of their life and part of their IEP and part of their learning. Well, they're learning all the other skills to become an adult. And then turning 18, it's the age of majority, right? And so incredibly, for so many of us, it's hard to believe when, we have our own 18-year-olds that that is the age of majority. That is when they become legal adults. And given, any other healthcare, any other circumstances, whether it's, supported decision-making or guardianship or any number of options that your young adult and you choose together, age of majority is a legal capacity. So once they're 18, their full legal capacity, they're held responsible for their actions and also for their health care. And we are not allowed to, as parents or caregivers or anybody else, for age of majority for a legal adult to be able to access anyone else's healthcare information for all kinds of reasons, legal and otherwise. So thinking about that is really important. And as a young adult for age of majority, are you required to have health insurance? You are in Massachusetts required to have health insurance. We all are as young adults, and in most other states as well. So I believe across the country, we're required to have health insurance. So thinking about what that looks like and what is their health insurance going to be, and also helping them understand health insurance. And we know how sometimes it can be difficult to navigate health insurance. So thinking about that and helping them plan that as well. Next slide, please. So what kinds of health insurance options are there for individuals who are turning 18? And as Pat was saying earlier, as we were preparing for this presentation, this is another entire presentation in terms of the different types of health insurance and what's available and what they all mean. But sort of in a broad scope, we can share with you, you can have commercial or private insurance. It could be individual or family. Your young adult can stay on your insurance until they're 26, if they so choose, if you so choose collaboratively. And if a young adult meets certain criteria, they can also stay on your insurance over 26. In the individual or family plans, they can, purchase an individual plan if that's what they choose to do, if they don't want to stay on the family plan. But if they don't purchase insurance, or they don't have insurance, they will be fined in their taxes, because that is one of the ways that it's enforced to ensure that every person has health insurance in the Commonwealth of Massachusetts. Another option is government funded insurance. So there's Massachusetts Health, also known as Medicaid. Every state has a different name for it, perhaps, but in Massachusetts, it's Mass Health. And there are a number of different plans under Mass Health. And again, that's an entirely different presentation that we're happy to share with folks as well at some point. But there's Mass Health Standard, Mass Health Common Health, for example. And, these can also be options with paired with private or commercial family insurance. So there's, all different levels of these things, but we're giving you a broad scope of what kind of health insurance options are there. And then, again, there can be a combination of private and mass health, as we were saying. So, there's a number of ways to access those, and you can always reach us at the Federation for Children with Special Needs if you have additional questions about that. We're happy to talk with any of you anytime. Next page. And so we do ask, Pat and I do ask, if you would please take a moment before you start your busy weekend learning all about transition, and go to the link below and just fill out a quick 4-question survey for an evaluation of how we did on this presentation. We collect the data and use it so we can, make better presentations over time, or learn from what went really well, and also to provide information to our grant providers on a federal level, because they want to make sure that you're getting the information that you need to make a healthy and well and happy transition to young adulthood for your child or your loved one. So thanks so much for being here. Pat, is there anything you wanted to add?
No, just thank you, everybody. And I think what Melanie said, one of the great services of the F2F, and Melanie is there now, is the ability to give one-to-one assistance to families. And so it doesn't matter, what the question is, just, reach out to her at the Federation. You'll be receiving contact information over the course of the weekend with how to get in touch with the Federation, but just reach out, because I'm sure she and everybody else there would be very happy to answer your questions.
Absolutely. And we look forward to talking with you. Enjoy your weekend.
Bye.
Bye.